Dr. Mohanta, thank you so much. Thank you for joining us and really appreciate you being able to be our moderator for the next section on from the dentistry case study. Dr. Sujuta Mohanta is with the Canadian Dental Association, and I'll pass it over to you to moderate the next session on dentistry with presentations by Tala and Tracey. Over to you.
Thank you very much, Ivy, and thank you all for joining us for this wonderful event. And I'm very excited to introduce Tracey and Tala. So who would like to go first, Tala or Tracey?
I think Tala's first on the agenda, so
okay, great, excellent. Okay, so I'm going to introduce Tala. So Tala Maragha is a postdoctoral research fellow at the University of British Columbia Faculty of Dentistry. Her interdisciplinary work in dental education focuses on the health and well-being of dental students, particularly in preclinical years. She's also involved in several teaching and learning scholarship initiatives that aim to develop innovative teaching tools using a well-being lens. So welcome, Tala. We're very excited to learn from you.
Thanks, Sanj, and thank you, everybody. Let me... All right. Here we go. All right. So again, thank you all for the opportunity. Today, I'll be sharing some of the findings from a study that we did on dentist mental health, where we looked at the challenges, support needs, and promising practices. A brief agenda for the presentation today. I'll start us off with an intro and background and walk you through the research objectives and a brief description of the methods that we used, and then a bird's eye view of the results given the limited time that we have for the presentation today, and end us off with some conclusions, implications, acknowledgements, and of course, references. So mental health of dentists, like many other healthcare professionals, is a growing concern. In fact, mental health issues ranked third in the order of frequency of health problems among dental professionals, and it was ranked as the third most common reason for ill health retirement for dentists in the UK. Some studies have indicated that in comparison to other healthcare professionals, dentists may have an increased risk for mental health issues. We have many studies that examine the factors that impact or may impact the dentist's mental health. Some studies have looked at gender and sex, and we use them interchangeably in this study because this is how our participants have referred to them, in addition to age and years of experience. But the evidence from these studies was inconclusive. Additionally, we have identified some knowledge gaps that inspired this study. First of all, we found that there is a lack of evidence around the role of the work environment and the work content in shaping the mental health experiences of dentists. And more importantly, we found that we don't have enough evidence to support practices or even discuss practices to address the mental health issues that are specific for the unique work content and work context of dentists. Additionally, we identified an empirical gap that relates to the methods that are used by the majority of the studies that examine dentist mental health. Like many other things in dentistry, we like quantitative methods, which are great, but at the same time, it means that we may not have the in-depth data that can explore or kind of help us understand the complexity of the mental health experiences of dentists. Therefore, we decided to carry out this primarily qualitative study to identify the mental health issues experienced by Canadian dentists and their contributing factors. And we also wanted to describe and identify the support needs, recommendations, and promising practices to better support dentists' mental health and well-being. So what did we do and what did we find? So this kind of figure that you see on the left-hand side of the screen walks you through the different stages of the study. So we started off with a scoping review of the literature to understand the lay of the land. What do we have? What gaps do we want to address that we talked about earlier? And we decided to land on a case study design for this particular study. We went ahead and interviewed stakeholders, interviewed dentists, and utilized the input from these interviews to develop a survey that we also had our dentists from all over Canada complete as well. So it was a multi-method approach that we did in order to capture the depth and complexity of mental health experiences of dentists. We utilize a gender lens, an explicit gender lens, in both data collection and analysis. And as I mentioned earlier, it's a primarily qualitative study. So for this particular paper, or for this particular part, we have focused on analyzing the qualitative data first, using a thematic analysis approach. And then we utilize the survey quantitative findings as a form of triangulation, which is roughly defined by Denzin and Matheson as the use of multiple data sources to better understand complex phenomena such as dentists' mental health and well-being. So again, these results are going to be shared in a bird's eye view. I should kind of make the disclaimer that they do not do the actual results justice, again, given the limited time that we have. So we had 17 stakeholder interviews between December 2019 and May 2020. And then we had 36 interviews with dentists between March 2020 and June 2021. And we had 397 dentists who completed the survey between November 2020 and April 2021. Whoops, sorry. Here we go. And this table, although may look intimidating, but it's just really a breakdown of the different categories and the distribution of our dentists who participated in the survey, which is the middle column, and the one on the right, which represents the interviewees. We had almost an equal number of men and women. We had most of our dentists in the interviews and in the survey own their own practices or are partners in practices, whereas we had a smaller number who worked as associates for somebody else's office, or they were sometimes also self-employed. So the presentation of findings, I'll first walk you through the qualitative data that we had and then present any pertinent survey data across. So the first theme captures the most common mental health concerns among interviewee dentists. So we have a range all the way from stress to substance use. And in between them, we have interviewee dentists who have reported experiences of anxiety, burnout, obsessive compulsive disorder, post-traumatic stress disorder, and depression. And we can see that aligned with the survey findings. So the most frequently reported mental health issue in the survey was mental or psychological stress or distress, followed by an anxiety. And we had burnout, depression, substance use, and PTSD reported in the survey as well. And again, because we mentioned that we had a gender specific lens, so in the survey, we noticed that a higher percentage of female participating dentists reported any mental health issue in comparison with men or male participating dentists. All right. So the second theme captures the workplace challenges that dentists have experienced and has impacted their mental health and well-being. And these three blocks that you see here on the screen are really a breakdown of the sub-themes that make up this kind of larger theme. So starting from the left-hand side of the screen, I'll kind of briefly walk you through these sub-themes and what the dentist perspective to that was. So the first one on the left captures the challenges related to patient care responsibilities. So dentists talked about demanding patients and how often they felt that patients were demanding perfection out of them. They also talked about the challenges related to certain patient populations, such as elderly or kind of pediatric or children in the dental practice. Some dentists have talked about ethical dilemmas where they were kind of torn between providing care for patients, for example, supported by a government program versus keeping their office up and running and being able to cover their overhead. And we can see that echoed in the survey. We had 7.6% of the survey participants who also reported experiencing ethical dilemmas as a source of stress and mental health challenge. In the second block here that you see in the middle of the screen is the challenges related to roles and responsibilities in the dental practice. So for dentists who own their own practice or were partners in practice, they reported the challenge of wearing multiple hats, being both a healthcare provider and a business owner. They had to take care of their patients while at the same time taking care of administration, finances, hiring, and retaining staff. For associates who worked in somebody else's office or in a corporate office, they reported experiencing bullying, a lack of autonomy and control over their schedules, in addition to conflict with practice owners and office managers. The last subtheme that you see on the right hand of the screen captures the loneliness and isolation, where some of the dentists have talked about the lack of support, lack of mentorship, particularly those who are practicing in rural areas. And as we mentioned earlier, the gender lens to some of those challenges. So for the patient care responsibilities subtheme in particular, some women dentists have reported experiences of prejudice related to their ability to carry out certain procedures, particularly tooth extractions that are part of the oral surgery procedure. Some patients have perceived them as less capable of doing so. And then another gender lens that relates, or a gender-specific finding that relates to the second subtheme, so roles and responsibilities in the dental practice. We noticed that there is a different experience for women dentists who owned dental practices in comparison with men. So this quote that you see here on the screen kind of summarizes the experience of one woman who owned her own practice. And she goes, when a man says something to their staff that they want something a certain way, the staff would feel that he's the boss, he's just being assertive. Whereas if the woman said the exact same thing, the staff may feel that she doesn't command as much respect or assertiveness. And this assertiveness, in fact, can be taken as being whiny or being bitchy. So it seems that in this women's experience, the women dentists as practice owners are perceived differently by their own staff. And there was also a description about the patients as well in comparison to men who are practice owners as well. And in the third theme, there was a discussion or a description of the personal and familial challenges that dentists have experienced and that has impacted their mental health and well-being. And again, starting from the left-hand side of the screen, we see that the intersections, we captured the intersections of age, sex and gender, ethnic origin with the mental health experiences of dentists. So in the interviews, we noticed that younger dentists have more frequently reported stress related to debt. So dentists who are fresh out of dental school in comparison with older dentists. And we see that resonated with the survey where we had 20% of the participating dentists reported stress related to debt and financial concerns as well. In terms of the sex and gender component of this subtheme, women participating dentists in the interviews have talked about the physiological challenges and the impact this has had on their mental health, including pregnancy and menopause. Minority dentists in the interviews have reported experiences of racism and discrimination by patients, staff, fellow dentists, and how that has impacted their mental health, particularly in rural and or remote areas. In the second subtheme, dentists have talked about familial relations and responsibilities. So caregiving emerged as one of the main findings in this particular subtheme. Where women dentists who participated in the interviews have particularly talked about the difficulty and the challenge of balancing their traditional gender roles in being the caregivers at home versus having their professional responsibilities, particularly when they were practice owners. And although it's not captured in those findings, but one of the consequences of that was that women dentists were less likely to own their own dental practice. Some of them have even transitioned to other roles such as associates in order to try and achieve that balance. We also had another finding relating to family relations and responsibilities where participating dentists have reported having their mental health issues stigmatized by certain family members, or even family members experience some mental health issues that in turn have impacted that of their partners who were our participating dentists. And we can see that again echoed in the survey findings here. So this table captures kind of the sources of non-work related stress. And the yellow highlights that you see on the table are the statistically significant differences that we found in the number of female versus male dentists who reported stress in certain categories. That includes caring for children, caring for others, not having enough time, and emotional problems. The number of women dentists who reported experiencing those problems was statistically significantly higher than men in those four categories in relation to the survey findings. And you can see the p-values on the right-hand side of this table. So what does that mean? We asked our dentists, if you had a magic wand to fix things, what would you do? And their responses can be summarized in the figure that you see here on the screen. Many dentists have talked about the importance of early awareness and destigmatization of mental health issues. Some dentists have talked about the need to incorporate mental health, resilience, and practice management content in the dental curriculum to better prepare them for their real world. And then some dentists have talked about the need to expand dentistry-specific interventions and formalize and even expand some of the mentorship initiatives, particularly for fresh graduates. And you can see here a quote from one of our dentists who goes, "My feeling that in 99% of the cases, if I had dentists in the room, everybody could see each other's faces and know each other's names. And you would ask who here needs mental health support, you would not get a lot of hands in the room. There isn't enough people who are getting the help that they need, and they attribute that to stigmatization of mental health issues in the community of dentistry." And of course, again, another potentially intimidating table that is essentially a summary of the great programs and initiatives that have been kind of led by several organizations across Canada. We have ones that are provincial, we have ones that are federal by the Canadian Dental Association, and we also have ones that are led by universities. They are essentially, a summary of that is that these programs are centered about helping individuals. They're not necessarily an organizational or systemic in nature. And up until the moment that we did our interview, so up until 2021, these programs did not have a formal evaluation going on for for their components. So what does that mean? It means that mental health issues continue to be prominent and quite complex in the dentist population. Dentists are unique, but also similar to some professions and their dual role as both business owners and healthcare providers. So we need more studies around the possible models to promote their mental health and that of their staff as well. And we also need evidence-based and gender-responsive policies, practices, and programs to destigmatize mental health issues, promote and support the mental well-being and health of dentists. Of course, a huge thank you to the funding, to the support by the SHRC and CIHR for funding the study. A huge thank you to Henrietta, Renata, and Milen for their support in the data collection and analysis. And of course, our great participating dentists, stakeholders, and partners in this study. And that is that. Thank you very much.
Thank you very much, Tala. That was an excellent presentation. I really liked how you talked about conclusions, implications, and then pointed out all of the current mental health support programs across Canada. And I see that we have a hand up from Ivy. Ivy, do you have a question?
No, that was just my clapping hand. So
Oh,
you
that's
can
good.
pass along. Yeah. So
Okay,
that
good.
was a great job. Thank you.
You're welcome. Thanks, Ivy. Now, I think it's so appropriate that you're talking about this today because last night I went out for dinner with 7 female dentists who are all practice owners, and we were talking a lot about what you discussed, the differences between male and female dentists with regards to patient care, but also male and female practice owners. And one of the things that we all agreed on was the most important thing was the peer-to-peer support, that we had female dentists talking to other female dentists about our issues. It was even ranked higher than, the professional support that we can get through counselors. So, I would love to see, your research being, used to advocate for more peer-to-peer support. For example, local dental communities having not just dental meetings where we do continuing education, but where we could talk about our mental health support. Because as you mentioned, if we ask dentists who needs mental health support, no one would put their hand up. But I think we should just have a meeting where it's like, we're going to talk about mental health because we know you're having issues. So I think that is great. Like you pointed out a lot of things that are bang on. And I've used the membership assistance program, which is provided free by, the Canadian Dental Association, and it's free also to my family and my staff. And I have told my staff about it as well, but it has a very low uptake. Even though it's free, it's online counseling, it's anonymous. So Tala, why do you think that, even though dentists have a lot of stress, they're not using these free programs.
That's a great question, Sanj. And I think some of what we heard in the interviews also resonate with what you just mentioned. So a lot of people were saying, "Oh, we tried to reach out, but we never heard back from the MAP program." In other cases, people would go, "Oh, but if I go and I talk to this person, they're not really a dentist, so they're not going to be able to relate." Some other folks have talked about the lack of time. They're like, "Oh, if to seek help, then I need to take time off of my schedule, then who covers for my patients?" And then it becomes, particularly if they're practice owners, so it becomes this entire convoluted thing with regards to barriers to seeking help as well. But I would say coverage is certainly one of them. The second most prominent one would be relevance. So exactly what you were talking about, Sanj, like people are participating dentists want somebody who can relate to their concerns. And unfortunately, because it was a very limited presentation, we could not talk about some of the great initiatives, the community-based ones, like, Women in Dentistry, or we have organizations in Newfoundland where women dentists are getting together to talk about exactly what we just mentioned, talk about their mental health and provide that kind of social support. Many dentists have talked about WhatsApp groups that has been helping them a great deal. So these kind of, I would say, non-formal type of venues are showing some promising results. But yeah, absolutely. I hope this answers your question. Sorry, that was
Yeah, it does. It does totally. And do you have any advice for what provincial dental associations or the CDA can do?
That's a million-dollar question. I would say, I think the first step would be to just kind of lend a listening ear to our dentists. I know in the past we had for example, the Oasis 500 series, where mental health was actually one of the things that were kind of tackled by the CDA, and it was kind of a platform for dentists to also join. So I think at this point it would be great to kind of, in addition to our findings, have dentists engage in terms of providing their opinion on what works best, how can we best support you, and then how can we integrate those great community groups with whatever the CDA is doing, and in addition to, of course, provincial associations as well.
Oh, great. Thank you, Tala. Any other comments or questions for Tala? A lot of great comments in the chat. Yelena?
Yeah, thank you. So I'm a member of the team, of the dentistry team. I was working as research associate in the team. So I just going back to the previous point, what associations can do. So there have been some mental health interventions that have been initiated by dental associations and recognize this need for mental health support from those who understand the unique work context of professional workers. So the example for the dentistry case would be dental wellness program, previously known as dental profession advisory program. That's early intervention that was funded by BCDA, and it was launched in 2019 to assist practitioners dealing with mental health issues in response to dentists' need for support from a dentist or a physician, not a psychologist, so that they can relate to the struggles and understand what happens with challenging patients and practice management. So I think it's like really important for associations to recognize that dentists feel more secure and more comfortable talking about the issues they're encountering with someone who understands. Thank you.
Thank you, Yelena. Yeah, I really applaud what BCDA has done, especially when they launched it right before the pandemic started. So that was perfect. And I like how it's dentists helping dentists. So thanks for raising that. Well, thank you very much, Tala, for that excellent presentation. We are now going to hear another excellent presentation, this time from Tracey Adams. Tracey is a sociologist and professor at the University of Western Ontario. She specializes in the sociology of professions and work. Within this broad research area, she has two primary areas of focus. The first concerns the changing nature of professional work with particular attention to social inequalities by gender in intersection with race, class, and age. The second centers on the regulation of professions past and present in Canada and in comparative contexts. Take it away, Tracey. We're very excited to learn from you.
Okay, well, thank you so much. Okay, so my presentation is also on behalf of the dentistry team and also on mental health. And you may remember back to the beginning of the morning where Ivy was presenting the sort of mental health leave of absence, return to work pathway. And there are just very few dentists that take a leave. There are about 13% in our study. Very few return to work. So we actually don't have a whole lot of data, although what we have is interesting on return to work. So we're really focusing on some of these the mental health challenges, because for dentists, it seems like these mental health challenges just really, build up to a point that people may be in a position where they're just sort of trying to live with it, or they end up leaving the profession. So, so we're focusing on these, both Tala's paper and this one, focusing on these various challenges that are leading to some mental health issues. You've met some members of a dentistry team already. So Ivy obviously is the primary investigator. I'm a co-lead of the project along with Mario Brondani, who unfortunately couldn't be here today. You've met Yelena, a co-investigator. Swathi Ramachandran is actually primary author on the paper I'm presenting. So again, she is sorry she can't be here today. And of course, you've met Tala. So of course, the background for the paper is really the challenges that the COVID-19 pandemic brought for health professionals generally, which exacerbated the stress experienced by healthcare providers. And the literature has highlighted some of these issues for dentists, and some of the key stresses included the nature of the work, which really left dentists exposed to transmission of COVID-19, financial challenges associated with practice closures, challenges with availability of PPE. There were a lot of staffing difficulties during the pandemic and other considerations. So there were a lot of workplace stressors that really seemed to get worse during the pandemic. Also life stressors, as Tala had highlighted in her presentation. So we're really interested in this paper in focusing on the impact of those stressors on mental health sort of during the pandemic as compared to people's reported mental health prior to the pandemic. And in this paper, we're also exploring the gender issues. Research has been a bit divided about the extent to which there is mental health, or if there are mental health differences across gender. Some finding no differences, and others suggesting that there is. So that's something we wanted to explore as well. And so again, we are zeroing in on the impact of the pandemic on the mental health of dentists, both before and during the COVID-19 pandemic, using the survey findings. And we're focusing especially on gender. We're also very interested in practice role, right? Where a dentist's working and what their kind of work context is like, what impact does that have? Whether someone's in private practice, is a partner in a group practice, whether they're an associate, whether they're working in another role, what impact does that have on their experiences of mental health? And so again, we're looking at these work-related stressors and life stressors. So this survey, and again, Tala presented a little bit about this. We had 379 respondents to the dental component of the HPW survey. It was pretty evenly split between women and men responding. And the largest category of respondents were in private practice, although quite a number were working as associates as well, or in these other roles. Our key outcome variables were 2, and they were self-reported health measures. We asked people, since the start of the COVID-19 pandemic, how would you say your mental health has been? And then we also asked them to retrospectively to sort of think before the start of the pandemic and to rate their mental health. And so this is self-rated mental health on a scale of poor to excellent. And then we also have variables on gender, practice type, work-related stress, and life-related stress. The work-related and life-related stress, again, we chose a variable that was just measuring the extent of stress they reported rather than some of the details, although I do have some responses there too. And so we both did some bivariate analysis, and we also did a regression analysis. And thanks very much to Henrietta Boateng, who did the analysis for us. So this is a sort of Sankey diagram that Henrietta actually presented, several of these earlier. We just wanted to highlight the dentistry component here. So you see that, when people look back prior to the pandemic, dentists rated their mental health as being better than practitioners in all the other professions. And that ranking sort of continued in their reports of mental health during the pandemic, but dentists experienced the same kind of sort of plummeting of the value of self-rated health with the pandemic. It really declined significantly. This table kind of unpacks that gender difference. And, what I kind of want to draw your attention to here is that during the pandemic, women were much less likely than men to report their mental health as being excellent and more likely to report it as being poor or fair. And this pattern really holds for the pre-pandemic rating as well, whereas women were less likely to report their mental health as excellent and here more likely to report it as fair. Right? So while there was a decrease, with the pandemic in reported mental health, that pattern makes sense that women were reporting poor health overall. Now, I mentioned that we were particularly also interested in the impact of work-related stressors on mental health. And again, just to dive down a little deeper in terms of some of the reported work-related stressors, this table is kind of busy. It's showing you related prior to COVID, during COVID, and then the difference. So I'll just draw your attention to a few things. One of the main contributors to work-related stress was uncertainty with all the changes during the pandemic. You can see for both men and women, the extent to which uncertainty was an issue during the pandemic increased substantially. Work overload was also an issue, but one that remained a little bit flatter. And in fact, for men, it actually decreased during the pandemic because probably people were seeing fewer patients. Some had their practices closed for a period of time. The need for more infection control kind of limited how many people, patients, practitioners could see. Also, there are differences, of course, which between men and women. So women had a larger increase in reporting poor relations with patients and clients, where men that slightly decreased. And women were much more likely to report an increase in experiencing ethical dilemmas, which again, Tala reported talked a little bit about those ethical dilemmas earlier. So these are the regression findings. And again, a busy table, but there's a few different things I want to draw your attention to. So basically, this first section is just looking at the impact of work-related stress on mental health experience during COVID and also prior to the pandemic. So what this is telling us is those that had found their work extremely stressful were about 5 times more likely to report their mental health as being poor or on the negative side, right? And so that's a very strong finding. It certainly, those who found work stressful prior to the pandemic also were more likely to report negative mental health, but it was much less strong. Life stress also had an impact, not quite as much as the work-related stress, but again, those who found their life stress sort of extremely stressful were over 2 times more likely than those who didn't find their life as being stressful to report a mental health challenge. And this component down here is highlighting that women were reporting poor mental health than were men during the pandemic. And in fact, that's a little smaller during the pandemic than prior to the pandemic. We've already sort of established that with our bivariate analysis that women were reporting poorer health. But why this is interesting here is because we're controlling here for the work-related and life stress. So even taking into account all those work-related and life stressors, we still have this gender effect on top of it. Now, you'll note that that table didn't include dentists' role in their practices, and that's because we found no statistically significant difference. So while the stresses of those different roles may be different, quantitatively, there really is no difference in the amount of stress being reported during the pandemic or prior to the pandemic in dentists' reported mental health. But the rest is just sort of a summary, right? Dentists consistently reported poorer mental health than did men. Dentists who had more work-related stress during the pandemic were much more likely to report worse mental health during the pandemic. Dentists who reported more stressful life experiences were more likely to report poorer mental health during the pandemic. And again, the relevance of gender remains even after controlling for these life stresses. So again, it really highlights the importance of work-related stress, which again was a factor pre-pandemic, but was really exacerbated by the pandemic and leading to mental health challenges. And again, given back what we know about that pathway, what we think is happening is that, well, one, a lot of dentists are just kind of suffering in silence, but two, it may reach a point where they actually end up leaving the profession because there are so many barriers that we've identified in earlier phases of the research to taking those leave of absence, including, you know, some of the factors mentioned earlier, the impact on patients, the financial pressures, the challenges in getting, you know, coverage for patients, the impact on staff, and that is really just, you know, leading people not to take a leave. So yeah, quick thank you to our partners, and yeah, that's it for me. So thank you very much.
Thank you, Tracy. That was excellent. It's interesting that you're talking about stress in dentistry and the workplace, because a recent graduate from the University of Toronto asked me, what is the #1 issue in dentistry? And my answer was stress. And it wasn't just stress from the patients, but stress of dentists. So I'm so glad that your research highlights this. Now, has there been any research started with stress of dentists or other healthcare professionals after the pandemic?
So, I mean, this is the really interesting thing about the data. There was the follow-up survey that the project just recently conducted, and they're still doing analysis. Henrietta was explaining earlier that we may not have enough respondents to really break down by profession, but I agree that is the big question. But what Henrietta was finding was just that for professionals generally, there's been a slight decrease, but it hasn't gone back to pre-pandemic levels. So we don't necessarily see that big return to normal necessarily. There still seems to be these lingering levels of stress and burnout and other factors. So I think that really is, and I'll be interested to see what Henrietta and other colleagues here at the project come up with, because that's a really intriguing finding, right? That continue to get those continued challenges, and to try and sort of unpack those a little bit more, I think is really important.
Yeah, Tracy, I see it in my own office and with my friends that the stress levels are still there. And I don't know how it's going to go back to those pre-pandemic levels. So I'm interested to see what you and other researchers propose. But we have a question from Sherry. So Sherry.
It's more of a comment and some empathy for, as a healthcare professional who does interprofessional collaboration research. And I have a grad student from dental hygiene, and we're exploring interprofessional collaboration and education among oral health professions. I just think that it's really important to recognize how isolated our dental and oral dentists and oral health professionals are in the context of when I reflect on where nurses work and, you know, how they have access to so many other professions that, you know, can help one another and also alleviate that burden. And I think it's only going to be amplified with the rollout of the dental care plan federally, that you're a point of primary care access. So similar to other professional groups, you know, you're interfacing with individuals who are also have heightened stress and anxiety, and I think that it could worsen if we don't support our practitioners that by the very nature of their profession are quite siloed in their practice settings. So yeah, just empathy, and also wanting to highlight that you're just further disadvantaged, I think, by the nature of your practice.
Thank you so much, Sherry. You hit it bang on. Like, a lot of people think, how can dentists be lonely? They're sitting knee to knee with their assistant. They're around people all day. It looks like a coffee shop from the outside, but no, like, we are looking in a dark cave of a mouth every day, and every few years there's another stress. First there was infection control, then there was COVID, then there were staff shortages, then there was an increase in staff wages. Now we have CDCP. Like, dentists are like, what is next? Don't put anything else on our shoulders. So thanks for bringing that up, Sherry. Great point. Thanks for your empathy. And Yelena,
Thank
we'd love to
you.
hear from you. You're welcome.
Linked to Sherry's comment, I just wanted to make a point related to impact of work context on mental health experiences of healthcare professionals. I'm currently drafting a comparative paper comparing mental health experiences of dentists and midwives based on Health Professional Worker Project. And our interviews reveal some work-related factors that are common to both professions and that may negatively impact on those professionals, such as heavy workloads, long hours, and difficult clinical cases. And some work factors contributing to mental health issues are profession-specific. And as Sherry mentioned, working in a small constrained space of patient's mouth and in private office have been identified by the dentists as a key factors leading to feelings of isolation among dentists. And midwives' inter and intra-professional dynamics, like including bullying and harassment, have been described as contributing factors to mental health concerns in the context of their work. So what, like, I guess a key message is that work context really matters.
Thank you, Yelena. And Tracey, do you have any comments about, you know, what we can do next, what type of research we can do next to think about how we can support dentists in the future?
I mean, I think that, you know, along with the conversations we've been having today, a lot of it is listening, right? Listening to dentists' experiences, getting people talking. And then, you know, because I think, as you were commenting earlier, right, when you get a group of dentists together, they share experiences, and they often have really good ideas of, you know, what would take to support. So, you know, just trying to listen and sort of enact on some of those challenges, though, because some of the problems are structural. I think they are challenging to deal with. And as you said, with all the shifts going on, including the Dentacare, but even, my understanding is there's shifts in the nature of practice, there's more corporatization, there's so much happening in the sector that I feel like it's a period of uncertainty. And then some of the solutions may also need to shift based on the challenges.
Thank you, Tracey. And Caroline, we'd love to hear your question or comment.
I'm wondering about whether we can draw parallels, and I don't know if the physician group is divided amongst like family docs versus specialists, but a lot of the stress that you have talked about in terms of the owning a business, high cost, the overhead, I think we're hearing a lot of the family docs now, like the person who's rural and has no coverage at all. So just to say, I think that group of physicians and GPs may share similar work stressors. So there may be something there to look at in terms of that future research. Thank you. This was really good.
That was a great comment, Caroline. It's not just about interdisciplinary healthcare and the way we take take care of our patients, but also how we take care of each other. So yeah, we can be a great support for each other. And I feel so much better. I feel like my mental health has increased just listening to all of your comments and what's being out, what resources are out there to support us. And, you know, speaking for dentists, dental hygienists, assistants, administrative, the whole dental team, thank you so much for all your research and your time. Keep smiling, and I hope everyone brushes and flosses tonight.